grateful to be with you all. I know how busy your schedules are and how valuable your time is. So this was requested, I think, by you as a team through the TDLs now that we've been selling the new Shield Plus product for a few weeks. We also have some additional MSA updates that I'm going to cover as well. So appreciate Ron, Bonnie, and team in organizing this. I know it is being recorded. I will also send this deck to the marketing team so they can be added to your SharePoint so you can refer back to it, because I think there is a lot of valuable information in it. So otherwise, I've built the content largely on questions and conversations that I've had with you all over the past month. So I'm looking forward to covering these. I've also built in some natural pause points where I'd be happy to answer any additional questions. Jacob, I'm going to ask you, just since I have multiple screens and things going here, I kind of try and keep my eye on the crowd out of the side, but you can always stop me if there's a pertinent question that comes up in the chat, something like that. So otherwise, I will get rolling. I'm really just going to start with some 101 and value. We are constantly updating this to give you statistics, industry findings that we have that you can really add to your arsenal as you're trying to tell the story of MASA. And I know it's particularly helpful too if we have some agents who are a little bit newer on the phone. So, you know, I have agents tell me, I get asked who MASA is. I don't really know how to answer that question or tell what your history is. So if you do get that question,
I was just wrapping up.
I've never heard of that company.
Would everyone please make sure to keep yourselves on mute out there? Thank you. Sorry, Brad.
No worries. Yeah, if you get asked, I've never heard of that company. What is MASA? I thought they made tortilla chips. We have been in business for 50 plus years now. We've been working with AMBA and your wonderful associations the past 20 plus. And we have nearly 70,000 AMBA association members who use the product. We have over 2 million members worldwide. We're very proud of our A+ Better Business Bureau rating. And most important to us really is we have received endorsements from the most meaningful organizations in our industry. That's healthcare, firefighters, first responders. They believe that we are truly best in the class, kind of in this underserved market that we fill with you guys. We're going to talk about many wonderful new benefits, really dig into the products today, but our bread and butter will always remain that we are protecting your association members from unexpected costs resulting from unexpected medical bills, gaps in Medicare or primary health insurance, especially those unexpected medical bills that can be crippling once they are received from taking a ground or air ambulance. Industry statistics help sell. I'm going to run through a couple slides here pretty quickly. Some important ones that we've updated recently. You know, costs are rising related to unexpected emergency transport. Ground ambulances now average over $2,000. Air ambulances, a life-changing $50,000. So limited income folks really get in trouble from these medical costs, as you see from the bankruptcy statistics that we have there on the right side of the screen. You know, expanding on that a little bit, I think these statistics also speak to this. You know, 1 in 4 families require an ambulance every 3 years. Medical costs in general continue to rise, especially true for ambulance rides, up 35% in the last 5 years. And something we really have been keeping our eye on, a growing concern in the U.S. is small regional hospitals, as they are feeling the pinch from government programs and the like, are closing. And that only means that ambulance rides take longer to get to care and thus are more expensive, you know, especially for your seniors in some of the rural markets that you do serve. A lot of people like to say, hey, I don't think this will happen to me or us. You know, I specifically like the statistic on the right side of this slide. Majority of emergencies between 51 and 90 years old. As we are continually studying statistics for your book of business, you know, that's the sweet spot of who you're serving. The average age of an AMBA MASA client is 72 years old. So again, we're trying to add a layer of security for them. How does your MASA plan protect you? We have been your trusted partner for protection and peace of mind for emergency transportation for a long time, as I mentioned. Our plans provide an additional layer of protection to cover emergency ambulance bills and related expenses left by your primary insurance or Medicare. The 3 main ways that we see your clients or retirees incur these unexpected ambulance costs. Number 1 is failure to provide medical necessity. there's a laughable thing that Sherry that we store. I think it's actually in your seminar deck of the Medicare booklet itself on the front. It freely admits that it does not cover ambulance rides all the time. So Medicare is largely always trying to find or back out of paying claims because of medical necessity. We know that your clients, when they call an ambulance, don't have the ability to determine whether the ambulance is a medical necessity or not. So as we as a company, as a supplemental benefit, are we going to try and fight with Medicare and get them to pay their fair share? But yes, we will honor our claim for you guys that we will pay and leave your clients with zero out of pocket. So number two, out of network provider. We are not a network. We don't care who the ambulance company or provider is. The last thing we want is somebody laying on the sidewalk when they've had an injury and trying to fumble through their wallet to pull out a MASA card or ask what network the ambulance is. And we don't care. Have your clients call 911 and get into care and stabilize as soon as possible. And then our last thing is number three, which is becoming an increasing percentage of your claims that we pay each year. We pay many copays and deductibles. Yes, they are smaller than the full $2,000 claim that I just pointed to. Maybe these average only $50 to $500, but those are meaningful dollars for those on a limited income, especially if they're having trouble with their health and need to utilize us a couple times a year, which we also see often. We pride ourselves on being an easy to use or physician product for you and your teams. There is no underwriting with our product, no pre-existing conditions. Added benefit for AMBA, worldwide travel is available on day one for applicable benefits, no matter which payment plan is chosen, monthly, 5-year, or lifetime. So really an easy add as you're positioning products for your clients. I'd like to highlight this. We were a little bit rushed with the kickoff meeting going virtual. We continue to see record number of claims be satisfied. So it lends really to two reasons, and you guys deserve a lot of credit for that. You continue to educate your clients, remind them of the coverages that they have available to them if they're existing members with us, or if they need us. And then really the additional benefits we've introduced over the past few years are leading to more and more incidents being covered. So we are specifically proud of our 98%, their satisfaction rate. Even with all the things we now cover, I do circle there and highlight, and I sound repetitive when I do this, but we are protecting your clients from out-of-pockets around ground and air ambulance. Will always be our primary value. It's the highest number of claims that we pay either from a percentage or dollar standpoint each year. So again, just key. We think that the cost of a monthly or lifetime membership, whatever you may be selling, is worth it just for the sole standpoint alone that we are covering and protecting from that ground and air ambulance. But then with all the other kind of benefits or additional gravy kind of on top. So I like to point out too, we are a supplemental product. The speed that we pay claims may differ for some of the other carriers that you have, but we've really put some effort and investment in this over the past 12 months, investing in technology. We're using AI to analyze and get smaller claims under $500 paid almost immediately. And I can tell just by messages, volume of phone calls and emails that I receive from you that we really have picked up in this area too, and we'll continue to make headway there and make sure that your clients are getting paid faster. So kind of as a summary here, MASA plan works in 3 easy steps. Reminder, we are not a network. We are a payer or reimburser. It's important to stress that to your clients. Again, call 911, get into care, get stabilized, then call us. We will work you through the situation. Send us the bill after the fact, and we'll get you reimbursed or paid. These are just a supplemental item that we've added to your seminar deck that I'd like to point out is available. These are real AMBA bills that we extracted as examples. So they reinforce the idea of how expensive a ground or air ambulance can be. This first example is a ground ambulance bill. It was turned down because of a non-necessity ride that I had mentioned earlier. We stepped in and paid the full amount for your client. Next one, same for an air ambulance. $40,000 crippling to me, you, certainly any of your clients. just reinforcing again a real life example of what we're trying to help with. That's kind of a natural pause point for me as we covered kind of MASA 101 and reinforced some ideas there. Jacob, am I doing okay? Was there any questions in the chat or anything I can address or just answer from anyone directly?
We have some questions about some brochures, which I think marketing will comment on here a little bit later. They are under final review and they should be available here in the very near future. Some concerns about response times with the AMBA dedicated phone number, Brad. So that's something we can take away. I do know MASA does track analytics and response times and all that good stuff around that phone number. And they do tend to have very good response rates. So if there is an issue, definitely let the field support team know and we can escalate those accordingly. Outside of that, have we updated the MASA portal URL? I don't think so, right?
No, that's a no. Brochures we are going to cover in the marketing slide. I actually have a slide about the phone number too.
Perfect.
So,
awesome.
Good questions and call outs. Appreciate the patience. So product information, we've made changes. I'll just go directly into it. To eliminate any confusion, we are still a 2-product offering for you in the field and your clients. Couple things I'd like to point out that happened in February, just as a reminder. Platinum prices did go up on February 3rd. That's the first time we've raised platinum prices since 2019. So frankly, we were due. For those of you who sell in Florida, pricing is now uniform with all other states. So that eliminates a little bit of confusion there. I think it made it easy to remember. So we are, like I said, 2-product offering, Platinum and Emergency Shield Plus. Maybe for those handful of agents on the phone who might do business in Wyoming, there is a reminder as of February 3rd, a little bit of additional good news as well. There is no longer a $60 application or enrollment fee in that state. As I've had conversations in meetings, this does seem a little bit self-serving, but it's just a quick reminder that AMBA, the good partners that they are, has increased the points on MASA products in 2026 to make qualifying for your monthly producer bonus as well as progress for qualifying for trips easier. So I am not the expert in this. So that's one thing that you can definitely reach out to your FML for if you have further questions. But that's a little bit of aid with the new product and helping you guys hit some of your bonuses. I can freely admit there was a lot of confusion, and as we were kind of doing, going to all the different regional and individual team trainings that I've done over the past month, a lot of confusion around Platinum products, what is covered, what is not inside of Platinum. I have these old materials from 2016 that tell me something different that you're telling me now. So I want to just put together a little FAQ and clarifications on it. Platinum benefits, protections, or coverage areas have not changed. In February, the only thing that we had changed inside of the product was just that 8 to 10% price increase, depending on what particular plan. So, I have had a lot that said we were taught Platinum was a worldwide product. Why is it any different than Shield Plus? So I want to stress, the worldwide benefits that were under Platinum were repatriation to a hospital near home, which that is incredibly valuable. I'll cover that a little bit later. Patient return transportation and mortal remains transport. Ground and air ambulance are or were limited to the US and Canada only. That's whether you're taking that ground or air ambulance to the hospital or it's a hospital-to-hospital transport. So I know that there's marketing materials. We are working and collaborating with AMBA. We are going to make those better. I'll cover that in a little bit, but just want to stress the MSA is and will continue to always be your go-to source for, product questions or confusions if you're trying to compare the 2 products. Now getting into Emergency Shield Plus, it's a robust product. It's being well received. I'm hearing a lot of great things from you guys in the field. I think it's important to kind of just to go through it again, the repetition, creates and aids in your guys' memorization of, what's available in the new product. So, it's hard. I know that there's a lot of benefits. I wanted to try and make this easy and segment it into what I think is the most simple way to understand it. So left-hand column, I know it gets small on this screen, is all the core emergency shield benefits that you are used to discussing. Those haven't changed. They are still the base of the product. The names of the benefits may change occasionally year to year when we update the MSAs. That is simply in the vein of making the benefit names themselves easier to understand and benefit descriptions. So I will talk a little bit about MSAs a little bit more, but the benefits they have not changed. I get notes or text messages, Brad, you took away this benefit in Emergency Shield Plus. Continue to stress that that is not the case. All the benefits that were available in original Emergency Shield are also available in Emergency Shield Plus. The additional benefits in the middle are those that are and have always been available as well too, with the lifetime upgrade if somebody makes the investment and chooses a lifetime upfront. So travel advisor, physician search, attorney search, translation, all of those good things are available, still available too with Emergency Shield Plus. And the most popular one I get asked about is the My ID bracelet. So for the lifetime upgrade in Emergency Shield Plus, we will continue to provide the My ID bracelet in its first year of premium service as a gift for your clients in choosing us. Over there on the right is the new benefits exclusive to Shield Plus. So again, not reinventing the wheel here necessarily. You probably see that those benefit names are familiar. I'm going to cover those real briefly here and then kind of go in. And I think that I've gotten better after speaking with you guys over the past 6 weeks. I'll just provide some real world examples of how the new benefits can be beneficial. And again, helping you craft a story when you're with your clients. So, worldwide emergency ground and air ambulance, I think that's pretty self-explanatory. Why those benefits I pointed out earlier used to be limited to only US and Canada. We are now covering a protection for those worldwide. Same thing with hospital to hospital ground ambulance, hospital to hospital air ambulance, previously limited to US and Canada, now available. As we did focus groups and really surveys of agents within your organization and ours, probably the most popular new benefits are our cruise ship evacuation and our cruise ship return benefits. So again, I'll give you some real world examples. We'll talk about that. We have a new transportation interruption expense protection. Should you be traveling internationally, we know how expensive those flights are. God forbid something happens because of a health incident or just an act of God, we will reimburse now for that travel interruption as well too. Worldwide vehicle RV return, I think that's pretty self-explanatory. Hospital visitor air transportation, hospital visitor ground transportation. You are in the hospital. We're going to help your loved ones get to you on a worldwide basis as well now too. God forbid you should need a transplant of some kind, an organ transplant. We will retrieve and get those to you as well if needed. There is a hospital expense protection. I have this one highlighted in a little red, this note there beside it, because this is the sole one in Emergency Shield Plus that is a little bit of an upgrade when they, again, choose to make the investment to do a lifetime plan up front. And then worldwide post-admission continued care transportation coverage, which is quite the mouthful. This is one that I get asked about. That's simply put, that's the one that was also available in Emergency Shield originally. That's when we get you to the hospital. We take care of you with benefits there. We will now also give you a ride home to skilled nursing, to rehab if you should need it. That one's available on a worldwide basis as well too. So I'm going to go through these one by one. I do like to point out the new benefits, especially on the left there. They do have some caps and are handled on a reimbursement basis. As you can imagine, it is hard to coordinate and work in these industries in foreign countries. They're still largely unregulated. That's why we didn't have these benefits, quite frankly, available before, but we've done plenty of actuarial work, research. We now have 18 months of claim data as well from our teams that have been kind of piloting or selling Emergency Shield Plus before it came to you guys as an organization. So these caps, we find that they fully cover folks in 99% of all instances and will be well received. So there is a lot of thought that has been put into those caps. So as I start going into them, very simply, I use the example of myself traveling over in Germany because I think it's easy to understand. Worldwide emergency ground ambulance works very much similar to how it would here in the US. You know, I trip on a curb or something, break my ankle, need to call a ground ambulance in Germany to get to the hospital. You know, I'm covered on that ride up to $1,500. The reason why this is a new and separate benefit inside of Emergency Shield Plus versus just emergency ground ambulance is because in the US and Canada, I do want to point out, since those industries are regulated, we are obviously in the United States, those do not carry the caps and there is no limit to the out-of-pocket cost should exceed that. Worldwide emergency air ambulance, $20,000. Same example as before, but maybe I am hiking in a little bit more remote area of Germany and get hurt and need to be lifted by air ambulance to the hospital. You know, will be covered for up at $20,000 in that instance. Worldwide hospital to hospital ground ambulance. Again, I'm hiking. In my example, they take me to a small hospital by the mountains where I'm at in Germany. It's determined that I need to get to Berlin for a higher level of care. You know, I can be taken by hospital to hospital ground ambulance and transferred to that larger hospital. This is usually where I get asked, you know, are these singularly exclusive? Can we stack these benefits on top of each other? Absolutely. If I take a ground ambulance to my first hospital and then need to be transported by ground or air ambulance to the next hospital, you know, that first ground ambulance is what triggers your access to all of these benefits. So we can stack as many on top of each other as needed to take care of your individual situation. So I just gave you a little bit of an example there. Again, hiking, you know, a little bit serious. I need to get rushed to the hospital in Berlin from the small regional hospital where I was initially admitted. You know, I can take that hospital to hospital air ambulance for $20,000. Second question that I've got, as I've done now half a dozen or so of these, is where is repatriation? Why isn't that on here? I pointed to that earlier. Repatriation has always been a worldwide benefit, still is a worldwide benefit and described as such in the MSA and Emergency Shield Plus. That's the one we're protecting, and we've told stories when I've been with you guys in person or maybe doing a presentation. Repatriation is our single largest protection that we offer your clients, especially more so when you're overseas. And that's where you get to the hospital. Maybe we covered the ground ambulance there with Emergency Shield Plus, but it's determined that you need a higher level of care and you need to take a medically equipped jet back to the United States, you know, to a serious hospital. You know, we cover that. We've told those stories. Those are the bills that run $100, $150, $200,000 and that we cover a few times a year for your retirees. So just want to stress repatriation still available, still a worldwide benefit, and still will protect your clients from those large out-of-pocket costs. So hospital visitor ground transportation, using my hiking example, I get taken to the hospital. My wife is with me in Germany. You know, she needs to take an Uber, taxi, or whatever the equivalent may be over there to come to the hospital. We will reimburse for that ride up to $200. Hospital visitor air transportation expense worldwide benefit. This one, I was hiking over in Germany by myself for some reason. I again am in the hospital, notify my wife. She can call MASA, talk with our transport coordination team. You know, they will make sure and coordinate for her and get her an airline ticket so that she can get over to me as soon as reasonably possible. Organ retrieval, organ recipient, again, I think pretty self-explanatory. Now, instead of just being limited to the United States, are available on a worldwide basis. Cruise ship evacuation and cruise ship return transportation. I think these are the fun ones. Retirees, we know that cruises are wildly popular amongst your clients that you're covering. I see a few emails a week. Brad, my clients are taking a cruise. You know, how do I make sure that they're covered? You know, so I love hearing stories like this. So cruise ship evacuation, exactly what it sounds. You know, you're on a cruise, the physician on board deems that you have a serious health problem and need to be escorted off, taken by helicopter to the local port. You know, we will provide coverage and reimburse for that ride. Cruise ship return transportation was the neat one that I found when learning about the product. You know, you get taken over. They thought you were having a heart attack once you get into a higher level of care at the closest island or port, and they determined maybe it was just really severe indigestion, but you have a cruise that has 5 or 6 days left that you had paid for, we will coordinate the transportation and get you back to the next port so that you can either get back on the boat, or if, unfortunately it is the end of your cruise, we will at least coordinate and get you back to your disembarkment port so that you can hopefully hop on your previously scheduled plane and get back home. Worldwide vehicle and RV, it's probably rare, quite frankly, if someone's going to obviously take their RV over to Europe. I don't even know if that's quite possible. But that was limited to a US and Canada benefit. Now, probably a more likely scenario for that would be if you have somebody that is feeling dangerous enough to take their RV down to Mexico, needs to be returned, we will help from there. So hospitalization indemnity protection, this is a nice feature add like I described for the lifetime benefit. I certainly know that you guys have other products that probably cover this in a meaningful way, but if you do have a MASA Emergency Shield Plus lifetime member and they can verify that they have been in the hospital for longer 24 hours for a medically viable reason, we would provide them a $5,000 indemnity payout for reimbursement. Transportation interruption expense, I did cover this a little bit briefly earlier. Delays greater than 3 hours, you miss connections, have a canceled flight, result of inclement weather, illness, act of God, anything like that. The list of things that are covered are pretty robust there. We will reimburse for up to $5,000 twice a year, which is a highly, again, popular thing and easy to position. So lastly, I covered worldwide post-admissions. That was just our ride home benefit in Emergency Shield as well. So I have been rattling pretty straight there for about 12, 15 minutes. I would like to pause here and just see if there's any specific questions about new benefits, or Jacob, if there was anything good that was put in the chat.
Yeah, I'll ask a couple of questions that were put in chat, and feel free to continue to put some questions in chat if you haven't done so yet. But the first one in there is the hospital expense protection for lifetime plan only. I think I saw on your graphic there, it did have a little asterisk next to the lifetime plan.
It is. That is for lifetime only. Again, I think we've organized the MSAs a lot easier if you have a client doing that, so you can always refer back to it. So it'll give you the base benefits that are available in the plan. And then secondarily, it say these additional benefits are available for those who purchased a lifetime plan. So the hospital expense production, or lack of better terms, that indemnity payment is available only in the lifetime plan.
Is the nurse helpline available 24/7?
It is available 24/7.
This is not a question, more of a note for everyone out there, but yes, it is an important reminder that MASA is a supplement to your insurance. It is not a reason to not have insurance. And also, if you run into clients who have health shares instead of insurance, it is very important that you understand that is not a form of insurance. It very clearly says on every health shares website, as well as on their ID cards in bold printed letters, this is not insurance. So good a reminder out there. Lisa, is that air in Germany, your example, a one-time 20,000 or an annual benefit?
Thank you. It is one time per year, which renews each anniversary date of your original sign up or effective date. Good question. And Jacob, I appreciate your extra context too.
And I would add in there, if you had a catastrophic medical event, let's say out in Europe while you're traveling, and you needed to be medically repatriated and flown back in the United States on a medical aircraft, it's probably something serious enough. You're going to spend a few weeks, if not months, recovering. You're probably less likely to jump on another globe-trotting adventure 6 months later. Yes, there is a very small chance of that, but just from the value opportunity of that benefit, I think an annual still provides plenty of protection for those folks out there.
Yeah, or if you have it happen twice in a year, you just have like the worst luck I've ever seen. So, we're constantly analyzing claim data, and we've never had anybody or had to decline somebody who needed that twice in 1 year. So.
Repatriation only available if you do a travel itinerary. Yes. I think we could even broaden that out and any coverages or services provided in worldwide area, or if the client is traveling into worldwide area, the MASA MSAs do instruct the client to provide MASA with a 10-day prior notice as well as a travel itinerary. So those are important things. If you're advising your clients, you know they're leaving the United States, especially going out of the United States or Canada, they need to be providing MASA, an agenda, an itinerary, and a 10-day prior notice.
Yeah, it's right, and that is how we should be describing it to clients. I mean, for you guys, obviously, this comes up from time to time. I know the travel itinerary. We've actually added provisions to the MSA that's in there that in some instances we will still cover what is submitted to us if it's a repatriation or something like that, but it will be limited. So if you have a repatriation that's $150,000 and it's limited to 50, that obviously still can be crippling to the client. So if you have a situation escalated up to your FML or Jacob, obviously we want to be cognizant and good partners, because we know that that can be, word can spread fast through the associations. So those are my heartstrings that I tug at a little bit, just being additive to Jacob's official response. But
I appreciate you being open and receptive to ANBA.
yes.
Next question on there, Washington State availability. I can tackle that one, Brad. Unfortunately, we still do not have a product back into the state of Washington quite yet. It is a Washington DOI issue, unfortunately, but it's something that MASA, AMBA, as well as the association out in Washington do tend to touch base annually, at least annually, on that topic and progress, and hoping to see something there out in the future for you, but nothing immediately, George, unfortunately. Um, does hospitalization protection pay if they went to the hospital directly and didn't use an ambulance? It's a good question.
It is, and I get this question a lot. There's something in our MSA which is called access to services. So the trigger for any of these is an emergency ambulance ride to the hospital when you're in the US or overseas. That's what does it. So lots of times I get asked questions like somebody has a surgery scheduled, can I sell them MASA so that they can, have a medically equipped transport home or something like that. So good question, long-winded in my answer, but no, they still need that emergency triggering event to be able to take advantage of that.
Next question, can this be sold in New Mexico? Unfortunately, similar response as Washington. Both New Mexico and Washington are very difficult DOIs from this particular product standpoint. We do have annual check-ins with both of these states as well as MASA and their progress or updates from their dealings with the DOI and any updates there. Unfortunately, no immediate news for New Mexico either.
It is. I mean, we invest and we talk about this constantly. I just say at the corporate level with Jacob and team, and we obviously want to deliver those states. We invest in lobbyists and the like to try and influence. So I feel those pain points, and we will continually try and be creative and figure out ways to get back there.
When will brochures be available? They are under final review and approval, and I think they may be available as early as next week on SharePoint, but very, very near future. What if someone purchased in Texas and moves to New Mexico? Will they still have coverage? That's a good question.
They are grandfathered in. Yes, you just would not be able to upgrade them to a new plan with the new address.
Question, how does Good Sam sell in New Mexico if MASA cannot?
I have to plead ignorance, and I'm not trying to avoid your question. I don't really know what Good Sam is.
Good Sam is a similar competitor in a similar space as you guys, similar to EA Plus and AirMed, AirJet, and there's a couple others out there. MASA is unique in the marketplace as How do I want to say this? It's a good question. Some of these entities and some of their competitors continue to change their benefits to avoid the ire or the scrutiny of departments of insurance. So that's one thing when you look at some of those plans, and if you look at the changes they introduce to their plans year after year, there is a reason they continue to have change benefits, and that's because they continue to try to avoid scrutiny of certain DOIs. So it changes by company to company a little bit, but something we continue to monitor.
You guys always stump me at least once on a call, so I'm going to email New Mexico tomorrow and throw them under the bus. But good questions. Just for the sake of time, Jake, is there any other? I just want to make sure that we get to everything. But
I think we can keep going.
I'm just going to, this one briefly, I think you guys are all aware we covered the additional benefits under lifetime. Again, we have the hospitalization indemnity kind of highlighted, and this just reinforces again my ID bracelet available for lifetime. So on top of throwing a new product at you in early February, we then had our annual MSA update as a quick follow March 1st. So I'm not going to be silly and read all of those new benefit names. I mentioned this earlier, we are constantly tweaking names to make it easier to understand. As you see some of our highlighted reasons over there, we removed coverage and where applicable, replace it with transportation protections. We don't really, frankly, want coverage to misconstrue our product either as insurance. Jacob just talked a little bit about this. And we just want it to be easier to understand. Our new names align closer to how the benefit is actually serviced. So just stressing, we had new MSAs come out. Again, no coverages, benefits, better coverage amounts or anything actually changed within that MSA. It's really just an update of benefit names. We do have a couple new benefits, which I will cover here in a moment as well. One other update I would like to highlight, we did make a provision or add an extra sentence to the grandchild and great-grandchild protection. I'm going to cover this just again because I get a lot of questions and I know that there's a lot of confusion. I think it's easy just to give you an example. So like Original Emergency Shield Plus, when I talk to successful agents, one of the main things that they bring up is the grandchildren and great-grandchildren protection, especially with retirees. You can tug at their heartstrings here because their grandchildren with a monthly or a 5-year, their grandchildren are covered up until the age of 14, whether they're with or live with grandpa and grandma or not. So say that I am a grandfather. My grandchildren live down in Florida. I am an Emergency Shield Plus monthly member. My grandson Billy breaks his leg at a Little League game, takes a ground ambulance to the hospital. His ground ambulance hospital ride is covered under my Emergency Shield Plus membership. What the extra highlighted sentence here is calling out is if somebody upgrades into a lifetime membership, and then if the grandchildren are covering with me, say I take my brood of grandchildren to Disney World, they are with me, I am a lifetime member. All of my grandchildren would then be covered, and that age extends out to 26 years old when they're with me. So grandchildren covered up to 14, whether they're with me or not. I am a lifetime member. They are covered up to 26 as an additional benefit when they are with me. Another one I think that is pertinent in these is we have expanded our coverage for disabled dependent adults. So think of this, they used to be covered up until the age of 26 when staying at home with mom and dad. This is somebody who's disabled, unable to work. Parents are deemed legal guardian for them. We now are extending that coverage with no age limit if they are physically unable to work, mentally disabled, illness, condition, anything of the like that is described there in MSA, and living with mom and dad. Mom and dad can now add them as a dependent to their plan. No age limit. Need to provide one of the 3 listed proofs of such there. and then emailed over to us, and we will add them to the plan accordingly. Kind of a simple MSA update. We now also qualify what the QLEs are. Now, I want to get into, we have 3 new benefits which came out as of March 1st. Would stress that these are for Shield Plus only, do not apply to Platinum. Our first being treat and no transport. So we will reimburse the member up to $500 in out-of-pocket expenses resulting from emergency medical treatment provided by a licensed paramedic. So back to my earliest example, I trip, break my ankle laying there on the sidewalk, not break my ankle, but I am laying there on the sidewalk, maybe think I am having a heart attack. I call an ambulance, very talented paramedics show up, they treat me there on the spot. No, Brad, you are not having a heart attack. You will be fine. There is no need to get into this ambulance, because getting into the ambulance in mile number 1 is what the trigger event is that covers or causes that extraordinary expense. So in this instance, the paramedics have treated me on the scene, deemed I don't need that. That was not previously covered by MASA in that situation. It is now in the United States only. So they can use this claim twice a year, up to $500. Again, we have done the actuarial work around that, and that $500 will cover most of those instances. Probably not widely used by everybody on this call, but being up in Northeast Ohio and close to Lake Erie, we certainly have emergency water ambulances here. So there is an emergency water ambulance transport protection now. We will reimburse up to $2,500 in out-of-pocket expenses incurred as a result. If you get hurt on a jet ski or something of the like, you need to take an emergency water ambulance to get into care. Worldwide emergency water ambulance transport protection. This one, very much like number 2 that I had just described, but we will reimburse up to $5,000. Easiest example would be here is if you're over in Venice. Obviously, they have waterways. Everything is waterways in the streets, etc. So if you should need an ambulance there now, you'll be covered up to $5,000. This one should not exceed $5,000 per membership for each consecutive 12-month period. That, again, resets on the anniversary of your effective date. So I know we've had some marketing questions in there. John Green and his talented team helped me put together this slide. We've been working furiously. We would like, and everything is going to be there in short term. So you can find everything on the MASA resources page on the field SharePoint. We have a product side by side there, Platinum versus Emergency Shield Plus, where you can show the differences in products. We, of course, have the product MSAs or policies there for both Platinum and Shield. We have paper applications if should be needed. We are working towards a state where we will be fully electronic in the near future. But should you have limitations around an upgrade, we do have updated Platinum and Shield Plus paper applications with the correct pricing, et cetera, et cetera. We will tweak this deck, make it fully compliant. You will be able to refer to that back there. And then pointed out in the seminar section of your field marketing, we have recently with your team as well updated your MASA Lunch and Learn seminar slides. Coming soon, as Jacob alluded, I know that as well that they are in final approval. We have the new Shield Plus brochure. There will be a customizable version of that on your agent self-service portal as well. We have a Platinum. It's very much like a brochure. It's a one-pager. It's deemed, and we designed it that way because it's specifically easy to email to somebody and follow up. And then final version was just put into my email inbox today. There is a popular thing that several requests have been of me when we released Emergency Shield a few years ago. There was a very popular how to sell MASA guide, which we have updated with fully new industry specific and statistics, and they are going to be again updated for the new Emergency Shield Plus product and Platinum as well. So we will have those coming soon items, I imagine, in the next week or 2 at the latest. And then as a reminder, you have a very talented team working on resources for you. So if you have additional requests, you guys do handle those internally, roll them up through your FML or marketing leaders, and they will get that. Last comment or call out, I do hear your guys' concerns when there are issues answering the phone. You know, we are still a small company. I think that this has drastically improved. I can also say it's hard, and I know that you guys have many carriers that you work with. When I go in and research situations where people aren't answering the phones, you guys are lots of times calling the wrong phone numbers or not listening for your individual prompt. So with that, we have created a new phone number that directly goes to your team so that you don't have to work through prompts inside of our larger MASA phone system and choose this. So we created this. This phone number is exactly only for your AMBA agents. You can see we made it neat and put the AMBA in there. So I would invite everybody to take a screenshot of this if you can. And then lots of times too, if it's simple things, the email response team, we have somebody working that primarily throughout the day as well. Partner services at masaglobal.com for response as well. So Jacob said we have metrics. I am constantly monitoring it. It does become a struggle if we have somebody who is on PTO or out. And this team is also largely, you know, they're paying your commissions, doing things like that. And they are working hard around the clock too in our large platform upgrade that we have coming to you in the near future. So, you know, just as a whole, when we eliminate the need for you guys to do paper applications, give you the enhancements that you need in the agent portal itself, it will eliminate a lot of the need for you guys to call and email in for upgrade amounts and things of that nature, and will free that team up for just service issues if you have a particular problem, with a client or something. And if you are experiencing long-term, or you are experiencing delays, it's preventing you guys from making a sale. I think your FMLs know this. Get with them. They can get with me, text me, and I will also service that as quickly as I possibly can. Otherwise, I appreciate you and what you do every day. I think you guys are amazing. I know that I'm lucky to work with you. I think we did pretty good on time here. Have a few minutes and be happy to answer any other questions live or that are in the chat.
Yeah, I'll try to rapid fire some of the chat questions out, and please continue to put your questions in the chat if you can. Where were we? Can we get these slides? Yes, these are going to be sent over to AMA training team and added over to SharePoint later today. I would emphasize, though, a lot of these materials, and they'll even usually say it on there, are broker and or agent training facing materials and are not necessarily client facing marketing materials, of which that's where I would make sure that you guys are using some of the great things that John Green and his team have put together, including, I think they're almost done relaunching an updated MASA seminar deck that you guys will all have access to through SharePoint very shortly. Question, so age 14 is covered, or is it under 14 for grandkids?
It's up to age 14. So 14th birthday, they no longer become covered. Good question.
Do you ever see adding a provision to cover special needs children into their adulthood on a family plan?
I think that we just covered that. We do that now. So I would back up to that slide, and I'm sorry, it could very well be my description, but yes, they used to be cut off at the age of 26, but now there is no age limit if they're living with mom and dad, or they're living with grandparents and their legal guardians. Just need to provide one of the verifications of information. Their email us over to that, and they would be included on the family plan.
So it does require medical documentation to be submitted along with the application or following.
Correct. So I've been told it's pretty standard in industry. If they are unable to support or work, they would basically have government provided documentation, which is just as simple as having like an ID. So,
what happens on that family plan with an adult special needs child when mom and dad pass away?
I imagine that their guardianship probably passes along to whoever family member would be covering them. So if you're asking me if they're still covered when primary member passes away, unfortunately, the answer is no.
So in those situations, we would want to probably write an additional plan or find another family member
Yeah,
that we can
we
write
can
on.
still always, if it's deemed that mom and dad pass away, they are self-sufficient but still disabled, unable to work. We're getting in the weeds here a little bit. I haven't been posed this question, but still have the ability, obviously, to purchase anybody who's over the age of 18 their own individual membership or policy.
If we wrote a Shield Plus prior to 3/1, are these three new benefits auto added?
Great question, and I'm sorry that I missed that. Yes, there is no need to do an extra enhancement or upgrade. Each member who has Emergency Shield Plus gets those new benefits as of 3/1.
This is an AMBA marketing question, but do we have platinum brochures? Unfortunately, there is not a brochure for platinum, but there is going to be an enhanced updated flyer that is provided here in the very near future. Can we get these slides? Yes, they will be sent to marketing to add to SharePoint. Can you confirm the number I called and not working? So I see the number on the phone or on the screen right here.
Yeah, that's discouraging.
Right, I called and got busy signal. Just beep,
Who's
beep,
that?
beep, beep. This is Deanna.
Oh, my friend Deanna. Of course, you would call.
Hey, Brad.
It is after 6. So my guess it might be that. Thank you for calling that out because we should have an answering or message on there of some sort. So I will solve that and send a note for distribution through Jacob. So I kind of sprung this on him as a surprise, but I had a couple issues with the phone come up this afternoon. So we will have a larger company-wide announcement coming up.
Is it up to 26 with both single and family charter lifetime memberships? I'm assuming
Yes.
up to 26, referring to the age of the kids.
Yep.
Do we need to add them to the family plan now if existing plan? Will exceptions be made if special needs child lives there? So if there is an existing family plan on the parents, do we simply, through a benefit review conversation, identify there's an adult child with needs and we communicate that through MASA?
Yeah, so this was asked when I talked with the MPS or inside team, and I did get a determination on this. So we think that the incident rate is so low that we do that. The actual language of the MSA is when they're purchasing a new policy or membership through us, that should be handled within the first 30 days of having the active membership. As a courtesy and good partner of yours, if you run into this situation and somebody needs to be added as a dependent senior child, it can be handled by, again, sending an email to that or me over there. We will make sure it's taken care of.
Those are all the questions we currently have pending in chat. We have a couple minutes left. First, I just want to say thank you to Brad for joining the call and providing this. Again, this call was recorded, so we're going to have this uploaded to SharePoint for your agents on-demand viewing so that you guys can go back and rewatch this when you want. I can kind of open it up, I guess, for any final last-minute questions.